matches up. And please, can you double confirm your date of birth, please? Yep, spot on, as it should be, of course. And just to double check, when was the last time your microchip was scanned? It's a very important piece of documentation. It should be scanned every time you make a visit, just to make sure you're not lost. Yeah, that's fine. What we will do today is I will double check that at some point to make sure that these long list of numbers match to your individual chip. It won't be invasive at all, I promise. It's just to check that you are really you, and I haven't got some imposter sat in front of me wanting to get a free checkup is all. Thank you. Now, I have down here that you are booked in for a cranial nerve examination appointment today, correct? Yeah. Well, please, could you give me some information about what's been going on and why you booked it? I see here that you've had a little bit of a symptom sort of development over the last few months. It says here that your eyes sometimes strain through the day and you find it hard to focus sometimes, and you were a little bit concerned, which, you know, is very acceptable and something that you should get seeked out just to check that everything is in working order. Yeah. Okay. And please, could you elaborate on that just for a little bit, just so I can get a proper understanding before we get underway? Oh, really? That's actually quite interesting. I haven't heard of that one in a while. Okay. I'm sure that can get checked. Well, let's just double check it, and the date of examination is... and that matches up to my calendar. Yep, all good to go. One it's going to let your snout really be the one in control, and I just want you to let me have a little feel around your gorgeous snout, okay? Thank you. Right, let's grab this. And I'm just going to gently, gently, gently have a little feel. Test some of your snout reactions to my touch. This is important because if for some reason your cells around your snout have any abnormalities, then I should be able to feel them be a little bit unresponsive, we will call it. You should be able to feel me gently, gently tracing and rubbing along your snout, just like so. See, not that bad, is it, my sweet floof? You are doing so well. Is that relaxing at all? It seems like it's definitely doing something for you. Okay. It seems like everything is in good working order in terms of the sensations and the sensitivity of this gorgeous, gorgeous snout of yours. Yes, yes, yes. Now, what I'm going to do next is I'm going to gently light some candles left and right of you, and I just want you to have a little whiff and tell me what it is you smell. That will determine how accurate those nostrils are working for me. Alright, you'll hear a little sound, hopefully, of when I light the candles. And all I want you to do is sniff and say the scent that you hear. Pretty easy, right? Gotcha. Let's give it a try. Now, with those 4 to 5 scents that your snout eagerly whiffed up, please could you give me the results on what exactly you smelt? Oh, really? That's a very unique answer. I haven't had that one before. It's kinda cute. And of course, I will record these results down. I just want to give you a proper, fair examination test. Yeah. So please, just trace, just follow, follow. Good, 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 good. Keep going, keep going. Perfect. Don't look away. Just keep going. That's a good flow. You are doing so well. Just keep tracing, following my claw. Good flow. Good, 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 good. Good flow. Perfect. That completes the first half of the test. Now, what I'm going to do is I'm just gently going to get you to read that wonderful diagram behind me. And please, could you read off everything that you can see on it for me? It's like, when they do that test to test your eyesight on your driving test, it's just to make sure that I know that your retina and cornea are not damaged by any ulcers or anything like that, or maybe your vision is a little bit blurry. It's just to check that you can see a standard like 5 to 10 meter distance. So please, go ahead and read that for me, sweet Floof. Yeah. Keep going. Yeah. And what does that one say? Yeah. Okay. Yeah. Just keep going round and round for me. I'm just gonna have a little look at how your eyes focus and concentrate whilst you are looking off-center that's definitely normal. I'm not sure if that blush is normal, but that might just be how you respond. Okay. Okay. And what about if I just rub for a little bit? What if I just rub gently? Okay. Very interesting. Very, very interesting. No, I promise it might look like I was petting you, but it was, I assure you, for the cause of the examination. Your reflexes and your reactions to being poked, prodded, and perhaps petted a little bit was quite admirable, and those results were simply, well, off the charts, I might say. That concludes that part of the examination. How about if I quickly move on to okay, let's do two in one. Let's mix it up. I want you to do some facial resistance for me. I'm going to be holding your face in parts just to see how you react and can resist against me pulling your head one way and the other, or perhaps holding just above your eyebrow and seeing if you can pull it back down. Again, I will be as gentle as I can, but here's the catch. At the same time, let's do some vestibular testing, and what that is simply testing those wonderfully gorgeous ears of yours to make sure that they are functioning as well as they should be. And if I find any abnormalities, I will be sure to send you to a nice, gentle ear specialist referral who might be me as well, but shh, that stays between us. I mean, have you seen my ears? They're very big, floppy, and great at listening, especially to a floof like you. But yes, what I will be doing is I'm gently just going to hold my paw like this, and I just want you to try and move your head against the pressure. I'm just going to try and move. Good. That's very good. Again. Good. Perfect. And now this side. Good. Stunning. Absolutely remarkable. Good. And now try and lower your head for me, and I'm going to try and hold you up. Nicely done. Now, the other side. Can you hear me? On this side, can you hear me at this level? Oh, turn, my sweet, sweet, beloved patient. Can you hear me on this side of your ear? I need to know if you can hear me, so that I know that your ears are working as they should be. Pretty please, my sweet, sweet flute. Can you hear me at this level, whilst hearing your upper ear be brushed and petted with my latex gloves? Good, 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 good. Such a good patient. Brilliant. You did absolutely wonderfully with that one, didn't you? Let's have a little look on the next one. Okay, so the next test is going to be the last little segment of the cranial nerve exam that will conclude the cranial nerve. After that, I'm going to do a little bit of a general checkup and maintenance on you. What that means is, well, you'll find out. But for now, the last little test is the accessory That's so good to know. It must mean that you're quite relaxed around me, doesn't it? I'm only playing, of course. And now let's just quickly check your respiratory rate. Just bear with me here. Please breathe as you